Good evening, ladies and gentlemen, and welcome to What's Up With That, the show that brings you interesting people, places, cultures, and subcultures here in the South Bay, the San Francisco Bay Area, and beyond. And tonight, what's up with AIDS? And what's up with the people who provide services for people suffering from HIV and AIDS? And furthermore, what is it really like to be living day to day HIV positive or infected with AIDS? Well, the first time that I ever heard about AIDS, I was a freshman at UCLA, and there was a patient that was admitted at the UCLA Medical Center who appeared to have 0 T-cell count. Well, the next day, the cover of the UCLA Daily Bruin, a newspaper which with absolute credence said, "Gay cancer hits Los Angeles." It was at that point that I realized that the panic was really beginning. Well, tonight, to discuss what is going on in the AIDS community here in San Jose and beyond, our 3 experts. Please welcome Cecile Cummings. She is a manager for HIV prevention and educational programs for the ARIS Project. Welcome to the show. Raul Gonzales. He is the chairman of the National AIDS Make-A-Wish Foundation. What's up with that? And Rik Yago, he is a fundraiser and coordinator of the National AIDS Make-A-Wish Foundation. Welcome to What's Up With That.
Thanks.
I guess the first question is, many people are confused with HIV and AIDS, and both of these terms get thrown interchangeably. What is AIDS, and what is HIV?
HIV is the virus that attacks a person's white blood cells, T cells to be specific, as you mentioned earlier, and AIDS is a kind of series of diseases that result sometime later on after the immune system has been depleted to a certain extent. So HIV is really what we usually talk about broadly about the disease now. HIV is the virus that people get from someone else who has the disease. Okay. And because they get that virus in their body, their immune system becomes destroyed, and they get these other AIDS-related diseases, acquired immune deficiency.
So what is the, you know, there's this level, I guess a T-cell level, when they define you as considered HIV and then full-blown AIDS. And what is that level? Do you see T-cell level drops to a certain point? And
I think it's
200.
200.
Right, 200.
And a normal person has how many functioning T cells?
12 to 1,800 or 12 to 15.
So that's, yeah, that's significant.
Something like that.
So,
I think it's 100.
Once this person, okay, Raul, you can probably best talk about this. When did you first know that you were HIV infected?
That was in 1992.
And how did you discover it?
I had PCP pneumonia and thought it was a flu. And just had the illness, the flu-like symptoms that I thought for about a month before going into the hospital.
Okay. So it actually just stuck around for a month and it refused to go away.
Right, right.
So then let's paint this scenario, and I know it's probably difficult to talk about. If it's too difficult, you know, whatever. So you went to the hospital, you got tested. Did you sense in the back of your mind at any point that you might be?
I sure did, yes. You know, I was at that time, I wasn't totally educated on the virus, but I knew there was things like night sweats, and it was just more than I ever had at that in my lifetime. And so I kind of had it in the back of my mind.
Right. So you went to the hospital, you got tested, you got called into an office, I'm sure, or something like that.
No, I was admitted at that time.
Okay.
I let it go to the stages that it was so bad that they admitted me from that point on. And also there was a tuberculosis scare, so I was isolated.
So what went through your mind when the nurse or doctor, whoever, said, we need to talk?
Oh boy, I don't recall. I was very ill at the time. I just know I was put in isolation. It was more of
When was this?
92. It was more of a lock you in your room and put you away from everybody.
Yeah.
So I felt very isolated and very confused.
Is that very typical still for
I
people
don't
with
believe
HIV?
so. I think there's a lot more education out there and more awareness on you know, how to treat the disease and also the complications on how to treat it.
Okay, well, let's talk about the disease, I guess, a little bit. How is HIV transmitted?
It's it's transmitted most of the time throughout the world. In most cases of HIV, it's transmitted sexually. It can also be transmitted through the blood, meaning blood transfusions. We all know that. Well, maybe all of us don't know.
Gigantic blood
In the
transfusion
80s,
scare,
right, the early 80s, before they developed a test, started testing the blood. And then people who share injection drug use.
Right, IV users.
Share blood that way. There's some evidence that it could also be transmitted through breastfeeding from mother to child.
Yeah.
It definitely can be transmitted while the child is still in utero, where the fetus is still in utero. Although now they're administering drugs like AZT, and many of the women who are getting that kind of treatment are delivering HIV-negative babies.
Yeah.
But primarily sex is the way it's transmitted.
Right. And with this comes a lot of confusion. You see, this is the real problem with this whole issue, is that
There's the confusion. Let me straighten it out.
Right. Well, there is a lot of confusion. Like, what happens if you're go and sit on a toilet seat of somebody who just peed? I hate to use, you know, and I mean, and this is actually, you know, AIDS has caused a public hysteria. People go into public bathrooms and, you know, scrub down the toilet seats, and you know, I wouldn't be too even shocked me to see somebody come out with a bottle of Windex or something, you know, having completely.
Oh, I remember in the 80s, some friends of mine didn't want to take their baby to San Francisco because they just figured San Francisco in itself was a risk.
That some little virus is going to just jump up on the ground
up and get that baby.
Exactly.
Yeah, it's and I guess people think, well, it's in bodily fluids. So if I touch bodily fluids, you know, I can get other diseases, certain kinds of hepatitis from a toilet seat. So why not HIV? Fortunately, with this virus, it's you have to get a pretty big quantity of the virus. It's only transmitted in certain fluids in very mass quantities. And those are semen and blood, and people usually say vaginal fluids, although I remember reading some research about that when I started working with a couple of women who were HIV positive. They kind of turned me on to this research, and they were actually having trouble detecting the virus in vaginal fluids or significant quantities.
Recently there was the story about where they were trying to document the first case of AIDS through saliva, and the story told out that the person, the man who was the male who was infected, had serious gum disease or something like that. And I guess up to that point, they have never really been able to say that. And I still think that they're not saying that. But saliva,
that you can get it
from kissing.
Yeah, they're starting to say, I think as of the last couple of years, they are now saying that there have been a couple of cases, very rare instances, where from very deep, prolonged deep kissing, people have gotten it. This is, it's hard to say because the partners, I think the cases that they know of, I think one of the partners was already known to be HIV positive. So how can you tell which it was? Was it, did they had sex at some time and not use condoms, or was it kissing?
Working at a place like Eris, where you probably get a lot of telephone calls, sometimes some people hysterical situations. Well, right now in the media we're playing out, I think, an AIDS hysteria situation that's happening as we speak in New York, where a man is being held in a jail in New York City and has had admitted to having sex with, now the number has risen just in the last 2 days from 25 to 50 people in these rural communities. This is not going to play well for the AIDS community.
No, it's not.
What happens when a backlash, with the backlash effect, with certain things like this? Do you ever feel that there's a sense of a heightened sense of angerment in people, a sense of distancing?
It kind of like blends the criminal element to the disease. I mean, that person, in my view, is a criminal, and it's attempted murder, in my view. You know, and that associates a lot of things involving AIDS.
Right.
So it gives a backlash at all, you know, in all aspects.
And it's a sad thing because everyone's going to be affected by that.
Right.
Again, Raul, you go to the hospital, you've been told that you have AIDS, okay? You might or might not have been told how long you have to live or what the expectations are for your life, expectancy is going to be. What or how did you plan or proceed to inform your friends and family? Because that would, to me, would seem a very difficult situation.
I was very fortunate. I come from a very small family with only my mom and my sister are my whole family. I don't come from a large family group. So they were made aware by my doctor and they supported me. You know, we were there for each other. I had faced a life-threatening disease before AIDS, and it was a blood disease. I was in the hospital for a little bit over 1.5 years at Stanford, so I had faced a life-threatening disease before this. I just knew I was going to conquer it.
Yeah.
You know, so I'm not qualified to say I felt like, you know, this was the last thing I could do. You know?
Well, let's say with Eris, do you get a lot of people? I know that the suicide rate with AIDS patients is extremely high. Do you get a lot of people coming in there just absolutely hysterical, freaking out?
Well, typically they're not hysterical, freaking out. I mean, they've gotten their blood test somewhere else, and usually in the past, anyway, up until, as we were talking before the show, until the recent invention of home tests, people were getting test results by counselors and at least having some opportunity to start working through their shock, their grief, all of that. So by the time they come to Eris, not that they don't have any problems, but they're ready to deal, just by coming to Eris, they're ready to deal on a practical level with their disease. They're seeking out services.
Right.
And with any situation, if people are dealing at a practical level, they've probably gone through most of their shock. We do, though, have a number of people who are still very angry about the disease. And,
Angry
you know, it's, well, angry at the world, you know. It comes with the territory, I guess. I haven't approached that myself yet, but death, I guess we're all approaching it. But there are phases of accepting death, and a number of those involve anger.
Yeah, that your life's being taken away from you.
Yeah, and that anger can be focused at the world, it can be focused at Eris, you know, it can be focused at whomever is handy at the moment. And so we see it. We are dealing with people in that situation.
At the human level.
Yeah.
I bet you it's very difficult.
It's intense, but I also think it creates an environment where people are pretty clear about what's important in life, and the office atmosphere is therefore pretty nice as a result. People are able to laugh easily, even though you know, there's probably more crying as well that goes on in that office as anywhere else. But
I'm sure.
Yeah.
It appears to me, you know, that as a group, the people that are infected with HIV or AIDS doesn't seem to fall into any particular social group or an ethnic group. It seems to be a virus that doesn't particularly favor anybody. It just attacks everybody. We do know that there's been a lot of progress in research and whatever, but right now, you know, it started as, like I said in my opener with the Daily Bruin, as a gay cancer and a gay disease, and the gay community took a lot of bashing for that. It's now a major health problem in the heterosexual community. And do you know what is the major infection group for HIV right now?
I think it's heterosexual women.
Yeah.
Well, and we can look
Teenagers.
young people and women. If you look worldwide since the beginning of the epidemic, you find that the disease has mostly been transmitted among heterosexuals through sexual transmission.
Right. In Africa, definitely.
Yeah, I was thinking about this the last couple of days, is this issue of, is this a gay disease, going to come up on this show? And I was thinking, you know, why did this disease get labeled that way? My experience, all the diseases I've ever known of are asexual. They don't have sexual
so, I mean, if you think of the think of the theories that you have come across when you're talking about AIDS, that it was Haitian workers who ate monkey brains. Okay, you know, that it was this and that.
Scapegoating is, I think there's a lot of fear, paranoia driven by fear, I guess, around this disease, and that people will look for they'll look for scapegoats, they'll use whatever kind of racist or sexist or heterosexist or classist groups that they can come up with to place it on, rather than dealing with the real issue, which is that, again, worldwide, all kinds of people get this disease, and we are seeing what we've been saying for how many years? 16 years. Anybody who's been involved in education is that's the truth about the disease. Now, unfortunately, I guess, in some ways, the statistics are showing us that. Actually, the groups in the United States, I just read statistics put out by the Center for Disease Control recently. This was published in the San Jose Mercury News. In terms of heterosexual transmission in this country, the incidence rate was highest among of all heterosexuals, was highest among African American and Latino men. So straight African American and Latino men. And they were pretty significant. I can't remember the numbers, but pretty significant percentages in terms of incidence rates.
As well as teenagers, extremely high.
Right, but still, those were the two in heterosexuals, and it was not, they didn't break it down by age. And it may have been young. But that, a friend reminded me as I was pondering over this, how could this be, of some statistics, or an article rather, that came out a couple years ago in the paper about the situation, the level of health care among poor people in this country, citing basically that it was the equivalent of health care in countries such as Bangladesh.
Zaire.
So it's not a gay disease, it's not a black disease or a Latino disease or whatever you want to say, but it's certainly, like any epidemic throughout history, is able to devastate most quickly marginalized populations, because those are the people we are willing to throw away to a disease.
Throw away. Really probably a sad way to explain it, but it's true, you know. Raul again, living with AIDS, okay, every day. What happens when, let's say, you know, you cut yourself, or what kind of issues do you play in just your daily living and cooking? You know, you cut yourself when you're cooking, you do something like this. What goes on?
Well, it really hasn't changed. I mean, if I cut myself, I would do what I did in the beginning. But if there was any blood transfer to anything like, let's say, food or anything like that, I mean, I would discard it. you know, or, you know, so that part has, you know.
How about just your quality of life?
My quality?
And as well as you've recently been diagnosed as HIV positive.
Right.
Just having that, just knowing that knowledge itself, you know, what do you foresee as upcoming changes in your own life? Things that you could...
I'm not going to change my life. I will eventually let the disease change me, if that happens. But as far as my daily life, I'm
This is get up and go. Huh?
get up and go.
Yep.
I work 10, 11-hour days.
Right.
I think it's more of a mental thing. If I don't let it get to me mentally, I'm okay.
Right.
It hasn't hit me yet, and I'm not going to let it hit me as far as I can help it. I've been with friends in groups that all you hear about is what they can't do.
Right.
I'm on the opposite end. This is what I'm going to do.
Yeah. I mean, I think that's the kind of
I've been friends with him for 3 years. Been with him through his ups and downs.
Right.
I was on the other side of the fence. He would get sick. I would get upset because we couldn't do things, couldn't travel or whatever. I slowly began to understand that. Now that I'm on his side of the fence, I look at it a little bit differently, but I'm still that same strong person that...
Right.
Because when the doctor called me up at work and told me, I was there by myself at work. I was bouncing off the walls.
I can imagine. I mean,
And
how could you describe it other than just...
He was the first
pure
person who found out. I called him up. And it's a strange feeling.
Yeah, I can...
It's a strange feeling. But I'm not going to let my life change right now. I'm not ready.
Right.
I'm not ready for anything.
So many people, like with any disease, and not just AIDS, cancer, or whatever, so much is up here.
Right.
You know, it's up here.
You know, we attend a social group that meets in Willow Glen 1 day a week, and there's 30 to 40 members. They're not members, but they meet, and they're all HIV positive, or the majority of them, or they're living with AIDS. And you hear such contrasting stories. You know, a lot of them are T-cell watchers.
Right.
They're pharmacists. They carry their pharmacy with them. And you know, the way I look at it, myself, and I can only speak for myself, is that your well-being is a lot in your mental outlook.
Oh, definitely.
You know, I don't have time to feel ill.
Yeah.
You know, I've got a lot of things I've got to do, and when I do feel ill, I'll spend a few hours saying, okay, I don't feel good, time to get up.
Well, there's like, you know, drawing on an old saying from the Stanislavski, which you may not know who he is, but he's the father of method acting. He always told his students, no matter what role you play, and so many of these roles are life roles, that when you stop living, you start dying.
Right.
Period. And that applies across the board, you know. And it's...
Yeah. Can I answer from the, address the question from kind of a second-hand standpoint? I have a very dear friend, someone I think of as a brother, who's a long-term survivor of HIV, has been infected for probably 15 years, and he was, like you guys, incredible attitude. He was a survivor, and he was not going to let go. He wasn't going to let the disease get to him, you know, until he couldn't control it anymore. And quality of life, I heard a lot over the years that I've been his friend about quality of life issues and dealing with HIV. And I kept watching him and thinking, he's got great quality of life.
Right.
And then just in the last year, he, you know, having absolutely no immune system anymore, and his body pretty much ravaged from medications as well as diseases, got a fungal infection in his sinuses. And that was, he came around a corner when that happened. It was a turning point.
Yeah.
And for him now, since he went home from the hospital, life is, if he can get out of bed, it's give yourself some morphine, get out of bed, go to the couch and get hooked up to machines that will administer medicine 8 hours a day. His brain is fully functioning, but he doesn't have energy. you know, he doesn't have energy to do anything but take the medication. And it's just been then in the last 4 months, in all these years that he has ever talked about, started to actually say, I know I'm alive, but what's the quality?
Right.
And now I understand what that means. And I'm sure for some people that could come a lot sooner if you don't have that, I'm going to fight this and win attitude. But it's...
Right, it's there. And it's happening.
Yeah, and for some people it doesn't. I mean, there are people who've been infected 20 years and never gotten sick.
Well, all of you are involved in various organizations, and maybe you'd like to share with your viewers a little bit about exactly what it is that you're involved with. You're from the ARIS Project, and the ARIS Project is...
Right. Actually, just a technical correction. Formerly it was referred to as ARIS Project, and now we're ARIS, which stands for AIDS Resources and Information Services. And ARIS is an organization with a pretty small staff, but about over 550 volunteers. We have a few different programs. One of them is client services. Under client services, we provide practical and emotional support through trained volunteers to people with HIV and AIDS in Santa Clara County. We also have a food basket program through our client services project, and I believe we give out about 300 food baskets a month to people in Santa Clara County who are living with HIV in their family. We have also prevention and education services, and we have several programs targeting some of the highest risk groups, very specific targeted groups.
And then you...
I'm the chairman of the National AIDS Association. What we presently do here, we're locally funded just by people's donations or anybody who will donate anything, but we grant people with an AIDS diagnosis a wish, and that can consist of the actual person or maybe a family member if they're too ill to travel.
There's a lot of theories about the conspiracies, how the epidemic started. Is this whitewash? Is this just... What do you feel about some of these... they've been born out of organizations like ACT UP. There's a biological theory that the government hampered with something and whatever. Is this true? Is this not true?
I could give my quick reaction and then turn it over to you guys. And I would say the main thing is, however this disease started, we don't know where most diseases came from. Most of them come from plants or animals. We need to focus on the crisis that's here, the people who are sick, and we need to keep people who are not infected from getting infected.
All right. I think that sums it all up. All right. Well, that's all the time we have for What's Up With That tonight. I'd like to thank our guests, Cecile Cummings from the ARIS Project, Raul Gonzales from the National AIDS Make-A-Wish Foundation, and Rik Yago, a fundraiser for the National Make-A-Wish Foundation. And I'd also like to thank the staff of What's Up With That. This year we were chosen as the winner of the WAVE Award for Best Informational Television Show. I'd like to thank Katie Richardson, our director, Loretta Beavers, our Research and Development and Technical Director, Laurent Bridine, Ron Mosher, Shannon Collins, camera people, and Leonard Pina, our floor manager. Without them, this show wouldn't be possible. And most of all to the viewers for tuning in every week and listening to what it's all about. And if you're walking down the street and you see something interesting and you wonder to yourself, hey, what's up with that? Well, tune into our show, What's Up With That, and maybe you'll find exactly what you're looking for. And we'll see you next week on What's Up With That. Good night, everybody.